And what is Dudwana, especially the new recruits, Moka say, Yinchi, Mokabe, Busumi, and Fancy, Afini, any moons and some son. A bassa, Yana, most more funny saying, a how Mujuma did.
Minya coffee, Medas and Amachi, I wait here for. In fact, na I near there because in our kind, Oba Apomudie Jumanima, a teamwork into doctors, nurses, pharmacists, lab, X-ray, all the way down to the cleaner. A team and the Juma na team na one of your pivotal members. Ewo house here. Jobi biano, onbecho ejuma. Ti anye de kwa.
Yanhwe ene nurses bebreba omo fie nso a me say ujuma de wafa medical institutions ni bebremu. Na hwe eye wo nurses ni so bebrebe wo fie.
Yeah.
Intimi posti omo and enema be from one san watimi abewie school ikura na abewie na afei intimi posti ni ade. How do they feel?
Kofi, for those of us that are hospital managers, share young nurses, you see, post your more. It's not easy. Obama hospital catcher say, "Oh, as for Doc now, he has stopped carrying his wallet for a long time." Like Ube Shani Pano, Obit me catcher say, and any day munye. Also money bibi.
And what can so catch the penny?
Yes.
If it's also crop pay my.
And you can meet about 4 or 5 people a day. I was a two bottom now maniska. Because the whole point is that Nipana start here Gyimah. Or here Gyimah over 6 months. The document I the crap say Yafan Gyimah still am I. Now there situation here
Opemsuo
even more difficult is that these are necessary to us, no. Within to make it easy for them for better here, no. We are necessary for some of your national service. As at now, no, just a year rotation, no. Okay, and sana this is kakraba.
This was we answer.
This is where we.
Na sabi oko bana or day rotation onye den wako.
Nothing. And the second category is almost why you form Gyimah. Or more accepted postings. Some of them to very difficult places. Why Gyimah 14 months, over a year and a half. They say come by. How Sasani Pano, there's no way I'll be to me I survive it. Adding.
Intimate to the cancer, even said okay.
Even during
2 categories.
Even during the rotation period. A year national service period, so 1 year period no. Will be a salary ma.
Intentional, then system failure,
difficult to pinpoint because at the end say, I say ya in a sa man about be normal. Akaho.
So young fan flow more rotation. Me it is said okay national
service.
And nipa no ntimi free nipa mu kran ntimi meka say oba Mampong hospital.
No.
Aban no NHS.
Ya sign we posting. Yes.
Who are signing nipa no? In the first place, who make a provision for an accommodation? Nedidiem. But who expecting to say onye sa rotation and son or baba valid for posting?
Yes. And a problem is 33 because Nipana ko school 3 years. Okay? And I think say now all care about the structure of nursing. For me no, it's about structure now you create for nurses and it's the same structure now and say I teachers no. Once Professor Charles Mafo can say me. Oba what nako senior high school. Wahena we waba teacher training and as nursing training. I feel they're buying some allowance.
And idea what to so.
And idea what to so. Inti look at the number of students I owe school. Nursing and teaching. I am more allowance. Compared to Sasikania de more allowance no. I don't know if I'm to anything to Omoka. Because allowance no you be any here. Inti your allowance.
I think say no na prof can
yes.
free no.
Yeah, your allowance to say here na wo apply for. Inti me here na ma apply. Me apply me start say me here juma patete me.
And you be here.
And you be here.
Me ko university throughout manje.
Manje allowance. Inti then na obi call nursing training school. You see your man allowance. Allowance the car and mau. Sometimes the whole term. Yeah, can't bomb 3 months, 4 months naba. And I like what's mixing out Professor Charles Mampong. He knows what Onindioka.
Oh.
Sometimes he soon as a political tool for votes. Nursing students, teaching students at school 1 year or my allowance in my I got 2 months me at to about new release of my allowance a mom to influence Sinombe to aba. So I say. So mean this na mekan say sine ahihye no. You think the data because nipa no go school no on my mechanical on to me hwe no there a fear there on to me hwe no on by apply no the allowance or the allowance I start to see it trying to betete but there on besre no masika bi wo ho sine be ya say nipa no e do the national service and as the rotation timer it me tianika Sikane saying it's not even and do 800 cedis
per month.
Yes. It's about 900. No, it's about 900 cedis.
So national service, yeah.
Yes, but more nurses no. Who said nurses no? Your categories. Your certificate. Okay. When I former enrolled nurses no, go school 2 years. And your diploma. Go school 3 years.
Okay.
Any what degree
4 years
degree for no we are or can't normal pool no no acquire national service into the degree in there because I NSS for the China canteen bosu be an nisika beba
NSS like
national service from the China canteen on there ne almost 771 or whatever no on sabeka but diploma no
any role for
any enroll for the Omonia national service.
Omonia. Okay.
But diploma for no certificate for Omonia. But diploma for no. Obey service near friend rotation 1 year. We rotation no. We sometime. We it is October, September ho.
Around this time, yeah.
We are obey sometimes to the following year February. We rotation last year. As at now, music and mine.
Ni sikan also
during the 1 year and my. Emunso wie nansen a omonso de mai
ene sa ban de cows hafa no pa
emunso tim sisi a omoye
no omokro mu wie de da kra de ma na wo so udi lie so
interest na on what is the hope on I remember now the year juma no and sometimes say juma na mai nyina because unim say sa young boy no and as a young girl na obe juma no sometimes onihwe no dey bawo
doctor prescribe gentamicin no ko diclofenac
chale wa bre wa stressed e komode no e fie so twe no cause obi ha ono akoye penyi wo fie ono san hwe ni nyanum keto wo fie
ne de wako nursing
ye de wako school nti expect say sia no say ska ba unsem
ye be man cross cancer ama wonso bi
what you say nti ana pressure do mo so no Edding.
And na mene prof kasa wudi agro na afi ene hook up ne.
Oh no, sisi ano coffee. O the sauce there was hook up. Obo ha sisi ano. O here like obi obehwe no. You know, and as a member in so yenye.
On the agro nche.
Ha. You know, inti young lady no. Who's a young lady's necessary? Into young lady no. Ne wache no. Also talk aduane.
A dying or high
dying.
Obitia dying.
Yeah, Jenny dying ka 1 year.
Bema be so and better na.
Obejatum.
Beja to won tria dying ka.
Don't tria dying ka.
Fanisa.
Inti bomu say undru beye 3 months, 4 months out the year in the service no. No nyum. And it's very common now. Obi to make a chair say dia kika kono. I was say like worry, because in that one you know who say
worry because then
help. Yes.
Doc, mami ma chef on tia say. Debi am ye din komo say am catch us say wo de to political party na space na show no so me di no to fato nchen o man na ye chechire yen hwe baabi a neman koyie ye ka ho asem na ye de correct no ene hwe mpanfo a me no mudi nkoma ye pese asem na eda ho no yen ka ne trao ye mo hunu die wom bi sabe wugina baabi mpo na wo ka unim de wo ka also defend the issue be if you want to support an issue tie the doctor kan tie the prof kan na wow the fato to enema bi now panyin bi ba no o kan asem bia wotun say ye ntro no otwa na asesa bia asem a o kan unim de o kan bibi na kire doc yen to aso
nti Opemsuo enye easy for
nurses no
the nurses eno de ye be can be abom enye easy o share the way what they go through okay within 1 year no what they could imagine nipa no oti kumase
ordinary to Mampong
ordinary to Mampong I mean Mampong is not a bad place
no
I mean,
yes
distance, just a distance ordinary to Mampong Mampong average a dime average it's about 300 cedis a month
okay
it's only 3,600 all right
me wa wonyaahwe for the month
and then hwinimu empty room
empane nyama bi
pa all those sanyama kitin
na no cut off region so obitual light
bill obitual water bill so we be obakotena no e kwan wa from hospital na
and so
transportation be shem into be say sanipa no ye posti na no or the cabe 9,000 10,000
I no afena e jane na esa ko pebo sia dia mano wa bra obetuna wie 1 year na hwe mai
nti abroche konene ye tu kwan ni ade no a lot of people no is out of desperation chale wa bre it's not prof kind no bebe tu kwan omo nkoye nursing no but omo ne say they all yen at least a man sika sen say
ko be nurse
but the betina your nurse wo mo wi omo tifie omo third year mom tifie ni
because now can maybe say so only akro no go through all these challenges frustration no your rotation we are man na ho keka na ni gise obeto aso say obeye nursing
if you person ye honest and no ye honest for baby o mewia sisi ano oya de foforo ebi masua ejuma
soap amunim soap ye ba
yes ebi mo ye ebi mo pamade okay ebi mo sisi ade wig ye very common to mo na esua wig obi esua makeup beads inti 3 years 4 years not the tifie no we're diverting attention from healthcare inti what's in 3 years no
very rusty
what we see at the palm and I say because wig no back one no boy you ask them it's explain okay it's a coffee to be so as I say like no boy or your wig back on so nya 2,000 cedis kana why not
it pays
in the end of time abai make so be so fa na adwuma no ibe no so establishing no ho ibe a menhia ha na oye na weeks obi anim no afi the posting by Ozionko Eastern region onko ada so be Gyimah nursing no ana so be pe kwan bi so na to bebi asisia no onya adwuma no obe transfer side no so a
otedwuma nya na adwuma che
otedwuma na no odi wig ato Snapchat and I say TikTok onya orders for her what's on bed on panie
Opemsuo to eno na sa no ba office wo yare wo pra wo hwe anu otwam
time da so
obi order
and ya ne sa masisia no from nursing no affected pharmacists almost 5 years now in positive pharmacist fee
5 years now
yes nancy na pharmacist junior pharmacist na some from early career pharmacist forecast omo be call strike
even last 2 years like omo keka omo say
na omo sika kem omo ye national service omo sika kem be 2 years afini etua ochina junior doctors
so I keka omo say
14 months into omo ka
wow
you understand it's not just the structure of nursing
a health sector
the structure of the health sector itself no poor maybe a hospital manager right
who crowd in there no Interim person me for na apart from so a medical doctor and was I a manager and today person there.
Interest na ha ejuma ne ye no because workforce now no ye ejuma no and me fancy obi wo hono ma ejuma no pe okunu ho no ye ejuma no but sika ma
okoba nso obi enim so ye nurse
okoba obi enim so ye nurse
nimpa boare
oh
ni tiri ho aye sakatu
no inti
uniform so man na
uniform ona na beto inti the nkofo hu on social media na omaye so emotional when it's just the tip of the iceberg.
Opemsuo.
You were thousands of people to say gusu wofi.
Obo demonstration no kra won yes ka kra no tia
yes ka for come e ma kra be join them but colleagues mates ni na no obi a frustration e na pour out in those two ladies no and I think over the weekend I make her show be say and not like that is raw emotion. Obi o ha obetimi akata ne de so.
Yeah.
Obi won so won timi because wa bre.
Doc said okay emotion one lady there na ese mu ache ebi mu won side ebi mu so if
coffee obi kana asem
wo na
wo tenchen
wonni mu bi
wo se wan kan
yi na wo na nke ntu aka
na no on the bank account no do ni momo so
let's acrodica na no na me say doc me send you obi momo me ne number me ask bibi na em say o number me repeat David phone
or the car
and I'm say na David we me da so be say me and I'm say also dey ba me ma number for or the number ma me I was expecting say be the din me hu ya na me yes me na say one ma wrong number was it hwa na fafa
because if you pa so Opemsuo dey me fa mu she muska muska
kofinie
opa ochina we dey share even if it's 100 cedis so hospital ben wa haya the fa come share haya like I say nurses on rotation na no obi ameje and now dey o drink no
bodukwan
they were both in Mintimbo. Because we born different.
Only can Brunini didn't be. Or no more coffee, was wow, this is Budukwan.
Understand?
That's what was Budukwan.
But the upper for Budukwan we could see mention. Like I said, next some way national service pay. You were warmed.
So sad.
The people who come out for it.
So sad.
Now they're taught to take away count. Say this is you giving it to them just to say thank you. You'll be shocked. It's not like a comedy or more, but the point is that just the fact that Obia Gyimah say, I appreciate what you're doing. Once the prof can say me so none mama koda hospital. Some of them ebi mu ha omu yi omakum omu ye adwuma no. Nyana pe me do Mampong no. Just me do Mampong na cars me nyanya accident, head-on collision. Nipa more than 20. But before I make safe come, I call baby accident this na staff na ho no. Virtual my baby.
Great.
You understand? In the one I'm catching my accountant say, "Child nipa no mo ha no mo yesing. O say obey 16 am. Mon call that more. Because there is no way a ombenya time kra could
that selflessness kra no mo dey approach is.
You wo nipa wo mumu a Kofi Omusana wimba 1 year. Sani pano oye bibia pepe o obekọ aso beto collection refa page obi tuaka no just say
if you run so no rent my own fanche no
and electricity ni a chama all those things no
one toy dum
all those things no ye nhwe hu ne say emmo apomodin de bi obi akọ hospital and a nurse for nemu na doctor for nemu ade and I say people are going through a lot. Me junior doctor, I mean, about 15 years ago, me or Confanoche. There report to Confanoche and you say, Opemsuo. A dine war on and so yes so. Inti wa unya dine, kwana ko high dine.
You didn't come bomb cracker.
Inti nandie, e bi call patas, e bi call bantan, obi ako high dine. As at that time, now we Gyimah 6 months and Sunday Chiaoka.
sa overlap na ewo mu wo ho no mo no.
Oh, yes, I did na
man. Na sa be do 1 year and over no.
Because we are 6 months now. Your fan so we normal. Until be ankasa. Na obi abos you 6 or man kasa fan ko 8. You do ko 8. Obi ankasa. After be say fan ko 12.
Is there no 14?
Yes, so to get to a point we were age ma 2 years in into anika.
And you expect the person say on to me nye de wo hwefi no no.
Meanwhile, young nurses, young doctors, young pharmacists, young lab technicians, omo na ye hospital life blood o. Omo na hospital moja. At a certain level, me on frame 9 p.m. say me be operation. Unless it's really, really serious. Because in him say younger doctors were. But the sani panam ni man nisika ma.
Even to say we your procedure be we your operation be theater. You need nurses.
You need
before the operation, during the operation, even after the operation in the theater.
First people are nurses.
Nurses. Vitals and
yes. But sometimes you can't say they are not important. Nurses are the most important part of the hospital, whether you like it or not.
So asem no kray bebre nim unless o medical field answer.
No.
A doctor or about or your consultation we are even before the doctor between a proper consultation a nurse
is the nurse
information and what
because nurse spend a lot of time
with the patient.
Inti say your ma omo kosa ho kire mu a it means say you value ejuma omo ye na you fa premium minimum nuchi
yemfa bon to omadwuma so
yes inti
and as no na o hwe yare for no na adwunu no yare abam
could you imagine the current 1 year also sorry 6 now jane ufira
say o de o kono me ba beto me adwuma so we pon
it be stage means I won pon also ko time of ada
okay pa adwuma say the business can you handle pressure so as I speak to you I owe my landlord 6 months and I'm still
in the house yes you understand imagine young person I feel no share Akwasi na sa pressure we na egune so
and unfortunately what we don't also take into consideration is obia waba profession or young for no one enthusiasm no
on the was zeal no person be here no new ideas or nyema we hu person we ye nti yes ana no maba mobu then I feel mo pe abrochiako oti UK or person ko oti US Canada Saudi Arabia bebia anywhere besides Ghana
baby mu ni Jordan
yes meanwhile na ye training omo so inti for me they make us a start free system I create IFN allowance no my allowance dey yet to say student loan opa na ukoje
enfanye campaign promise
ebedu ye beto aba Opemsuo you can so you know mala wan ye tua
MPP can NDC can abusiamba bia wa wutie no ho maka to say your problem o say politicizing na ebe kwa ba and one a problem NDC woso you face an MPP buy no you face the same problem no and NDC aba you face the same problem say an kan okra na anhwa anya
everybody does it
you be kwa basa
do say ebe to aba let's say Friday Monday
they are too
alawana bo na like aden ye be sa meanwhile obi o ha
ono make say odo ka bia be 3 years no odi mu be
6 months abro obi so ho no ma sa alawa no ohia tamani ho confirmation na alawa ne ba ata no mo koje wo na rural bank bi wo silver pharmacy ho sa na jo no idanyo mbe to bantima high street no
more de
obi to to watch no to sardine
Allah
because he cannot hear it you understand so yeah allowance is a student loan it's a loan ojia unim say waji student loan o start say wo ye adwuma ye betete sina be ya sa sika no ebi be wo ho
nso pa crampo de nkameka sa ba mutimi identify more with the numbers
yes because obi wo ha minya obi wo ha ohia if ye and I say ye no so ubu ha or scholarship so now osanse say me san so amount free allowance into by the time ani pa new school no na age allowance 3 years into sika ben na o start juma wo de ba be tuanika so na awofo ni bi nso ho no ma enkola ni re school a omo nya enkola omo ya adults omo start school a no mo jai omo responsibility ni na into nipa no okọ school ni na on san hwe ne ho
san kura pe bia ba fie
yes or your bad no ya kwa boni or be man no a bad boy because after all ukoye the abeya na so mu ye bia betimi atobe nso chena and I say now kind ukoye coffee some friends ukoye hook up ubenyiska
be my friend and one na da one na da
aha ubenyiska
otina gidema san jisika
yes into once a baby baby no na fi de passion also the adwuma no
Wamusika. The easiest way to make money.
So, inti yabese abai ni pinform shisha nyama we no. Say health die ye fan to chacha. Unim baby a ubenya problem. I was say we hospital quickly. Because asem to a uni choice of baby asem ne beto. Now we do na say nurse for strike. Pharmacists go for strike. Doctors at the lab for strike. That time no, or private hospital they be a call Accra no. You are far away from them. Maybe are making what baby or baby. Now some baby too. Esida. Those are feed ye frail. Oh doctor, and now only mobile. Hasi. No, so your calls man call for. Help the
one between put system no
system ni play or I don't know between free Ghana next me free Ghana na oko US watch on the exam oko US within about a week no any adwuma.
And the unfortunate part ni say ya money pan allowance ba we intimi ntuanika into one sky ya wasting any pan okwa brochira ya prepare na mo freely
the money is lost. So the allowance 3 years no oko. We want to mean tracing je. And I also near why you say or the student loan so now fan say 3 years no. Every year crown oh man no. Allowance 12,000 na. Which is 1,000 cedis a month right? 36,000. The fan say zero interest. Or status or year juma a starting nurse, staff nurse, the salary about 4,000 a month. Who says won't mean just says kind of back?
I check 1 year with
so it's a structure of making sure so okay, this is the nurses loan system, this is the teachers loan system. Inti who apply ubenya here don't apply.
And I say na prof campo. Ye mo ko nyina na nke bia ye si quarters bi new nurses
yes.
Doctors new we mo nyina
make it affordable. Inti meaning say magic posting akọ kofinim tonto krom
ayi ama ewo bekwa amanse o de meti odi na ayi galamsi intine ma meti di
tonto krom yo baby to say adanse alata these are a howa
kwan so nye
me call sa dance area ho nanse ahun ho ba for nye de koye me twa picture the road de koye a quine who ye nambush but health centers wo ho
nye do akọ ho
what I say ye do akọ manso kani ego chiri ho ba bi edan ni ho
wo na akọ pedan wo light charge be charge of cry nye wo ye
ensantua wo ka
there be NSS ne de doc a lady yenti ne kakram se ne wo de chair kura
I want this simple clever question. MPP are buying my clearance form. What am I in the month of August 2024? Besides, an MPP what the strength, the financial strength to pay us. At the internet, one pay, one fire, no one try at least 2 months. And Sunday, Akotuaba. If we say 2016, or catch I say, or Yatuaba mana, or be restore allowance. And Yakotuaba man, no restore allowance. Whether we voted for him or not, once he won, you know, Wouldn't it have been better, say, and call better a post here or my clearance? No, or be post here near the time back say thank you. Say, son, I'm more generous. I go to your outer. It is someone in a sick hour no more. And for my clearance, call better any time. Sick anyone to know my clearance or one fire. What the other buy and what city cow wants to know. We revoke because everybody was saying, sir, you have a pamunasis. And maybe before the crane, you would say, Namia Chiamoka, Munacha for your Chiamoka, you have a pamomo. I never been to a kind of suit to be Tina, a Casaniano, I trust a woman too. Am I yet Yasu? You say, oh, you're not your junior. Send out credit to the one some time you're welcome. And then to never catch it, I said, what about Toya? Now that you are not to meet Chiana Nagana for a kick. I said, we don't revoke. I don't want man coffee. I will share Gyimah. I'm dying. Every time I want a simple, clever question. MPP are buying a my clearance form. What am I the month of August 2024? Besides, an MPP with the strength, the financial strength to pay us. At the in a one pay, one fire, no one chair at least 2 months, and Sunday a Kotuaba. If we say 2016, or catch a set of Yatuaba manner, or better restore allowance. And your Kotuaba man, no restore allowance. Whether we voted for him or not, once he won, wouldn't it have been better, say, and call better a post here or my clearance, or be post here near the time back say thank you. Say, son, I'm more generous. I go to your outer. It is someone in a sick hour no more. And for my clearance, call better any time. Sick anyone to know my clearance or one fire. What the other buy and what city cow wants to know. We revoke because everybody was saying, sir, you have a pamunasis. And maybe before the crane, you would say, Namia Chiamoka, Munacha for your Chiamoka, you have a pamomo. I never been to a kind of suit to be Tina, a Casaniano, I trust a woman too. Am I yet Yasu? You say, oh, you're not your junior. Send out credit to the one some time you're welcome. And then to never catch it, I said, what about Toya? Now that you are not to meet Chiana Nagana for a kick. I said, we don't revoke. I don't want man coffee. I will share Gyimah. I'm dying.
I always say we have serious problems and we need serious people to solve them. Yentimi and to us say Danny da bibia ye be politicizing no much as obia wona lady adwene and aso ne adwene who say out of frustration people can go off and sometimes if you are not in it you can judge wrongly. It doesn't make the profession.
No, you see, she's talking good. From or kasa free
pain,
a place of pain. What I say, I don't know what kind of any yemfa bibia antunche or kasa free a place of pain. Inti or say nano for me and confirm fan channel. You understand? But me as a professional, I'm not going to sit on radio and say the health minister has done anything bad. I think say even in that heat, for him to get down and come and face them, it takes a lot of courage.
And then I was say, "Ma, be at as I say, any issue say you politicize
yes.
at all.
You can't
blame the health minister.
It's not an issue to politicize.
System wabetum. System wabetum. So because system no so favor. You know, tina dog me do. Me I me dey tie for share. You must say your problem.
A problem na.
And the hono
because Kofi oh hey. Now until staff 1 year.
1 year.
Now until staff 1 year.
1 month.
Cry na no be
and Drew.
What I say? Now they could imagine 1 year. Now 1 month. Now over no. Almost more year demonstration. No abesha office.
Na no mo nkasa nka hwe.
What I say? But it takes a lot of courage and discipline. So be Pierre Monte.
Opemsuo.
And so baby shaum. Even if unim say we shaum on many engineer kana we pee.
Yeah.
So for me, I really respect the health minister for that. It's bold for him to do that. But and also for him as a leader, no, Emma no come into contact with the problem. No, with the human side of it. Like I was saying, young lady, she spoke out of frustration. Into whatever our kaya annual be adeno, but real issue no I can say the politicization of omu postings no is affecting them negatively and wow into a year idea we Bonnie Becker said you don't have to reinvent the wheel. Other countries aye omu timi efa omu apomodine for ne omu teachers because plan wo ho covid next one omu pass here any number pass you teacher for we school number we school inti so we number pass here I think say President Mahama said something na say it was a vacancy no you declare our district ho in say me was Asante Mampong na me say me here nurses 500 oko portal no so Mampong na 500 wo me say me Kumasi metro na say me here nurses 2 na wo asa yes and I mean say more 500 me here 500 no or say me make a plan say 500 ni na ba let me accommodate you you understand and sometimes no you find any seriously tamana me we just no just so landlords association about together say so be back na so be dan na so your nurse in kwan dia ye ngini 2 years e be ngini 1 year
god
yes
nti reduce burden
stress no because ya na nko kan say nipa no be ma 1 year only 2 years ayi
na Gyimah no be no so community
na benefit na obenya say nurse too fee
mo amuto nyina mo ahwekra mo nko hospital
yes
mo ho no ma simple
yeah nurse obebre ho no ma omo nyom tifie no oba hospital fe no anti nurse kwaku yare o na ye ba wo ho
ondi line
odobi si enim nti ebe say we dey may advocate ama me nurses
wa so wa wo ka ho
say kofi dem dey ahye ne kon onye Opemsuo radio for fuzi mu nam dey ahye mo kon Mensa hospital dey 20 steps away mon wo dey pa memma medical director number munye lunch buffet mom Opemsuo for mon video
as a matter of mo crowd there said okay maybe aduane na menya mfama o na support when it comes to our programs thing
with the programs them I support but like almost let you how ton I confirm be omototo come up so we are not to be 100 among
and then we come to one more
no you see F you understand now the very first place I'm here Gyimah Ashanti region near Continency right Bosomche district now for about a week na yensuo mba and community na decided yes say the way I insuo mba no omo ye sure say doctor baby otini insuo ni mba ti mi wo Gyimah no mo first say oh say me wo adomara kwani bia mi mo menchom baby esi na ombe konsuo gum
wow
community no consume am 1 week
but even that
is it coffee 1 week meso ya na pano na buckets be 4 AC if you water
wow
just because they want you to ombe be Gyimah and me ti se minya coffee amenu me de ti me pe kokwa ya chi
so dem no na ntacho
and no be tie say oh yes doctor need
esa pe kokwa
me beef you one day like what
now we say over free ho nyame ansa anyo wadom yes o na ansa anyo ba bi no duane emmiwa
so I say sometimes community no eba ina me mom Mampong say I love being in Mampong
exactly
wrong because obia jeje ofefefe so wrong nti o ye Gyimah kra na en say na how because we say there community no omo wo ho ma nti me my fan say next for situation isolated next to fee you catch it say more than a year ni intuane ka young nurses na make on once intuane ka if you ra with the rent no home so it no be chiao ka nya botrema no ne de bia na nurse na tata the bosses are no dwane fifi
no gu nani ase nurse won tua na o cancer na ya mususu nurses na ni ase Mr. Amwa, all the kakabeko and San Macomb line.